Hello, I'm Dr. Collins, and in this clinical examination video, we are going to explore the Babinski sign, which is one of the key signs in distinguishing upper motor neuron lesions from lower motor neuron lesions. Before we demonstrate the Babinski sign, let's have a brief recap of what upper and lower motor neurons and their lesions mean, so that we can really appreciate what this sign tests for. Upper motor neurons starts in the brain's cerebral cortex or brainstem and travel down to the spinal cord. Here in the diaphragm, the upper motor neurons are represented in green. The job of the upper motor neurons is to deliver the commands from the brain or the brainstem to the lower motor neurons. And to be able to do this, they meet up at the spinal cord, and in particular at a region of the spinal cord called the anterior horn or the ventral horn. Upper motor neurons end here, and lower motor neurons begin at the anterior horn and travel from the spinal cord directly to the muscles as the receiving end. A simple way to think about this is with a two-step telephone call analogy. So, if you want to move your leg, your cerebral cortex gives a ring to your spinal cord with the upper motor neurons. Let's call that line 1 and says, we gotta move that leg. The spinal cord receives that message and using the lower motor neurons, and let's call that line 2, delivers that message in question to your leg. You gotta move. An upper motor neuron lesion occurs when the first call from the brain to the spinal cord is interrupted, and the lower motor neuron lesion occurs when the second call from the spinal cord to the muscle in question is interrupted. Depending on which one of these lines is damaged, patients develop different sets of signs and symptoms. We have summarized these sets of signs and symptoms with a useful quick rule in one of our previous short videos. Make sure to check it out as part of your quick smart learning. As you can see, Babinski sign is one of the key clinical pointers in determining where the damage has occurred. If Babinski sign is positive, it means that a problem has occurred somewhere along the line 1. So you should consider a clinical problem that directly affects the brain or the spinal cord above the anterior horn. A few examples of such differentials would be strokes, tumors, and multiple sclerosis. The last point to make before we demonstrate the Babinski sign is a note on its clinical value. Babinski sign has a very high specificity, ranging from 88 to 99%. This makes it extremely useful in ruling in upper motor neuron lesions when the sign is positive. However, it has a low to moderate sensitivity of around 50%. In other words, a negative Babinski sign does not rule out upper motor neuron pathology. In order to perform the Babinski sign, ask the patient to lie supine or sit comfortably with legs extended. For simplicity, we will be demonstrating the examination on one side, but remember to always perform the examination on both sides. Using a blunt object, stroke the lateral aspect of the sole, starting at the heel and moving towards the base of the toes. The key point here is that the stroke should be firm but not painful, and it should follow the outer edge of the foot and then curving medially inward across the ball of the foot. Observe the big toe and the other toes. A normal response, which is called negative Babinski sign, is if toes were to flex or curl downwards, which is plantar flexion. In positive Babinski sign, the big toe extends, in other words, bends upward, which is called dorsiflexion, and the other toes fan out. Before we conclude this video, here are a couple of clinical pearls examiners absolutely love. Firstly, a positive Babinski sign is completely normal in infants under 1 year of age. Their corticospinal tracts aren't yet fully myelinated, so don't fall into that trap and call that a pathology. Secondly, Babinski sign can occasionally appear positive under temporary circumstances, such as during acute illness or intoxication. So always make sure to interpret this sign in a clinical context. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical videos in our channel. Good luck!